am going to start our Q&A period. If people need to leave, as they often do at this point of the webinar, please do the evaluation before you go off during your day. And I will start. We had a lot of really good questions come through, so hopefully I have captured them. There was one of the first ones was if the presenters could comment a bit on using complex systems approaches to help in all policy, especially with respect to evaluation. So I guess a more complex system type of approach rather than just a community approach. I think I've gotten that.
So I can offer something on that. So our project is a research project aiming to understand the implementation of health and all policies. So we don't really focus on evaluating outcomes. But that said, when we think about how to study the implementation of health and all policies, we have found that it's very messy, and that using complexity theory and systems theory has been very helpful. Because while, by nature, if something is complex, you cannot predict the outcomes. And as a research project, we want to be able to, study outcomes of implementation anyway. But we have found then that systems theory offers a way to help us detail as many of the components about a government implementing health and all policies as we can. And once we've detailed those components, we've actually developed a systems theory about how governments work when they're implementing health and all policies. So it's been really useful for us to be able to reflect on the findings of our research and to try and understand why some approaches brought partners together, whereas other approaches didn't. And it might be useful if you're trying to think about setting up an evaluation of outcomes of a health and all policies initiative. So that paper, I'll paste the link to it in the chat box. But it is a systems theory framework about how governments using HiAP look. And it might just be another step to think about, well, what comes out of that system in terms of population health outcomes or social outcomes.
Yeah, that's fantastic. Thank you. And I can certainly share as resources get posted in the chat box. I could certainly in a couple of weeks share anything that is shared, anything that's posted with participants down the road as well. So that's great. Victoria, did you want to add to that, or?
Yeah, the thing about this is that in terms of evaluation, we work on, because of our work is on it's funded by the Ministry of Health. In terms of the Plan H program anyways, and we are like on a year-to-year funding model. They want to know right now what are the impacts of what you're doing. They don't want information about what's going to happen 5-10 years from now. And so that adds a lot of pressure on us to sort of prove that what we're doing has an impact on community well-being. And so there's that piece. So like we actually have to find ways to show that impact in lots of different ways. And one of the ways we do that is to not talk about ultimate outcomes, but talk about intermediary outcomes. So what are the particular policies that are being put in place in communities across the province that we have supported their work together with the health authorities and the public health staff? So we do that. Like we look at those policies, we look at the partnerships that are being developed out in the communities and the importance of those partnerships in terms of moving forward on this kind of work. We talk about what are the built environment changes that are happening that we have been part of supporting those initiatives. So those intermediary outcomes that we can report on, and we can say, yeah, this is what's happening in terms of over the last year within that community. Here are the changes that have been made. Here are the new policies or the new built environment initiatives, that kind of thing. And we can link those to community health and well-being in the literature. The literature guides us to be able to do that. So that's that. So that's part of the challenge of trying to do that. But it is very complex because it's very difficult to pinpoint what we're doing now and what may or may not happen 10 years from now. Right?
That's great. We have a question. We have two questions actually from Cora Jansen in Saskatchewan. And her first question is, so she makes the point that in Saskatchewan, health is outside of the municipal government, and so therefore the concept of shared budgets isn't really feasible at this point. And so, does that mean advocating for municipalities to consider health impacts in their policy decision? Is that a useful thing? Does HiAP only apply to provincial or federal governments where all parts are under one umbrella? So what do you do in a situation where shared budgets, for example, aren't really feasible? Ketan, do you have something to offer to this?
Yeah, so while I focused a lot on health and all policies being a government-centered intervention, there are certainly models out there where, just like what you were talking about, where public health is outside of government. So in Ontario, we have a system of public health units that sometimes are integrated into local governments or sometimes sit outside of them. And we're actually, in our current case study project, we're studying the implementation in Chatham-Kent and Elgin-St. Thomas County, which are right next door to each other. Both are sort of rural communities. And the only difference is that in one case, public health sits outside of local government, and in the other case, public health is within government. So it's providing us with a really interesting opportunity to study exactly that issue. So I can't tell you too much about, how do you do it when you're outside of government, except to say that people are doing it when public health is sitting outside of government. And it really is about sort of building on the relationships you already have with government, it seems, and getting buy-in from them to have public health. Well, so what's happened in the cases in Ontario is local governments have bought into the idea of public health helping them do this kind of policy making. So they end up being integrated, if not legally, into the local government. At least they have a seat at the table and play a sort of leadership role. There might be other ways that, if you haven't gotten buy-in from a local government, you could still sort of be advocating for this. Certainly you could make this an objective of your own public health organization to foster healthier public policies in different sectors and maybe try to sort of influence them through a more advocacy model. But there are examples, again, of public health being outside of government but being brought into the table to help lead this kind of work.
And so if any of our other listeners on the line have examples that they could share, I'd encourage you to maybe post that in the chat box or even your email, and I could do a connection and connect you with Cora and others as well. And so Cora's second question is around critiques of health and all policies. And one of the critiques is that health equity is not mandatory to be examined, and that health and all policies can sometimes be reactive. So any comments to address sometimes that health equity isn't there and the reactive nature?
I mean, I can start. I think those are both very good points. Health equity often gets lost in the mix. It's hard enough to sort of get a bunch of people around the table to buy into the idea of health, let alone health equity. And I think it's something that has to be, so I don't know what to say in that chart. In some cases, health equity is explicitly a part of the strategy document or the mandate. In other cases, maybe because it wasn't so easy, health equity is there implicitly. So it'll be focused on health, but you'll see that by the long-term strategy, they're really focusing on improvements in maybe vulnerable populations, so that it's implicit that health equity is an objective of this. But I agree that it's really easy for health equity to get lost. And what was the second part of the question?
It's about it being reactive, that sometimes health and all policies approaches can be reactive. And so
absolutely, yeah. And that's, I mean, and that is one model of doing health in all policies, is to be reactive. So, for example, in Thailand, there's a constitutional amendment been put in where citizens have the role to call for the government to do a health impact assessment on a project if they worry about the impacts on their well-being. It's kind of like the way that in Canada we have the right to call for an environmental impact assessment. And so that is a reactive approach. But on the other hand, it's been now constitutionally mandated that citizens have the right to do that. So it's reactive, but it's also quite a strong intervention. And I guess it's, it's one way of doing it. And maybe it's not as proactive as people would like. And so I would just encourage you to try and build towards a more proactive mandate.
Our next question is from, go ahead, Victoria. Was that you?
I just want to address, I'm thinking about the previous question too, okay, actually maybe I'll take it off. Is that better?
Yeah, you're good.
Okay. Is the trying to understand, like in terms of, for us in working with local governments specifically, the term health may not resonate with them at all, and in fact often doesn't, because they're like, well, that health is not my thing. That's done by the provincial government. Don't ask me to do something that is, don't ask me to do more, kind of thing. Don't download your responsibilities onto me. And so we try to approach it in a different way completely in terms of, okay, well, what are the equity implications for what you're doing, for instance? Or how can we think about a wide variety of different population groups in terms of the strategies you're putting forward? Have you thought about, parents and young children? Have you thought about seniors in your community? Have you thought about low-income populations? Even asking those questions can have elements of a health and all policies approach, and incorporating that, making that as sort of standardized or some sort of formalized process where those questions are put forward. That to me is sort of incrementalism. It's getting there. So it doesn't have to, and it doesn't have to use the word health ever, because often, as I say, that for us, our experience has been that the reaction isn't always positive. It doesn't always work in terms of being able to get together with a common vision. So, yeah, basically, yeah. If we can find ways to improve health, improve well-being for communities, for everybody, for all, we actually will help improve health and well-being. So that's part of our experience, and we have, and I don't know how. Well, across the province of BC, we have these healthy communities teams, which are wonderful sets of people in all the regional health authorities, so they're public health staff who are doing all sorts of wonderful work around building those relationships with local governments across the province. And and we learn a lot from their work as well.
And that's actually, you might be able to pick up on this next question then with that. So Erin Wilson posed the question of, how can health and all policies be used that help citizens navigate government health systems and social services systems? And so a little bit about that interaction with citizens and participation of communities. Can you start? Do you have something to add to that, Victoria? Or Ketan?
Yeah, so I mean, this sort of gets to my last point, which is that I would say that citizens have not really been brought into the process very much. But particularly, citizens always have that advocacy role at their disposal of trying to put things on the government's agenda and raise awareness about problems that need to be addressed in a more intersectoral manner. And we've noticed that in some of our case studies. There are instances where advocacy groups influence how health and all policies shift new policies or programs, but it's not done very well right now, or very broadly, let's say. It's not usually a feature for citizens to actually have a seat at the table. In the cases that we've looked at in Ontario, again, Chatham, Kent, Elgin, St. Thomas County, they use community tables involving government, public health, private business, and community organizations. So there are some examples at the local level where community organizations have a seat at the table, but in terms of helping citizens navigate services and that sort of a thing, I don't really have any examples.
Okay. Victoria, I didn't want to cut you off. Were you trying to get in?
No, I actually, yeah, we don't do that as much. Our work is more about some of those sort of more upstream sets of services like housing and transportation and that kind of thing. So we don't necessarily delve into citizens navigating health and social service systems.
Yep. Okay. There was a question from Laurier about Littlejohn's, and I think it was mostly addressed to, she was asking about building capacity using local assets and resources. It was from one of Victoria's slides on the 10 key components of healthy cities, and it was around the systems change and how to evaluate systems change. But Victoria, we pretty much answered that one, I think, right?
Yeah.
And there was a question from Doug McCall. So if health and all policies brings benefits to all of those participating sectors, what about measuring outputs that are beyond health outcomes? So what does the health sector bring to the table that would also help those other sectors, such as education, transportation, and does health need to be at the center? We talked about that a bit already as well.
Yeah, I mean, I would just say that's absolutely right, particularly in the short term. Assuming you're interested in health equity at the end of the day, it's much more useful to look in the short term for changes across sectors, health, social sectors, all different sectors. It's a matter of identifying where you expect to see those changes so that you can measure them and then have the evidence. And I did have a table towards the end of my deck which shows you just a little exercise of thinking about seeing the non-health outcomes that can come from building healthier public policies, healthier policies. So I think that comment is right on in terms of the needs when you're doing health and all policies.
It's one of the things we talk about in public health often, that one of the challenges with addressing health equity is that the solutions are beyond the health sector very often and the health-specific sector. So it really is that intersection that is such a big challenge. We have a question from Stuart. Would well-being in all decisions be a way to communicate these concepts with diverse partners instead of using the term health?
Can I answer that, Dianne?
Yes, of course.
Oh, okay. So I just saw that actually last night, an article somebody had written. I'm not sure who it was, and I'm not sure where they were. I think I saw it on Twitter. That said, would it make more sense to reframe it as well-being in all decisions? And I was like, wow, that's great. I like that idea because I think that sometimes the word health trips people up. So perhaps a different frame might help with some audiences, anyways. So, yeah, I just thought it was a very intriguing question, and it's a really interesting way. One of the things I think we can, in public health, I think we need some more communications. There's something about communications and the expertise that they bring, which can be super helpful for us, I think, in terms of connecting with other sectors. And because that's what you really need to be able to do. We have to come together for a common vision, so we have to better understand all the different sets of language each sector, each different group is using, and try to find something that we can all agree on. Well-being in all decisions might be it. I don't know.
It might be, and it's different sectors and also different communities and different populations, and what the word health means philosophically to the people that work with and the communities that we work with, and does the term well-being, I'm thinking of Indigenous communities specifically, for example, who tend to talk about wellness. the communities that I've had experience with talk about wellness and well-being, often not using the term health. So it might be different terms for different partners as well. So
can I just add a couple of things there? I totally agree with that. You notice that in many different cases that health is a term that is not the most effective, and it just, it usually stems from the fact that the health care system is often the lion's share of a government's budget. And so people in other sectors are used to a bit of fatigue about health, and the idea of health imperialism has come up, that why are we doing another thing on health? So I absolutely agree with looking for different language, and I think it applies even to working on one-on-one projects within a health and all policies initiative. So you need to, just as was mentioned, that you need to, by Victoria, you need to learn how to speak the language of your partners. And so that's one of those technical challenges, and something that why you need dedicated health and all policies, human resources, and budgets, because those people have a very specific set of things they need to learn. How do we work with each and every sector and speak their language and frame what we want to do in a way that makes sense to them? So that's a lot of learning, a lot of work. Yeah.
It is. Yeah, it is. So we have a question from our friend Karen Serwanka in Manitoba, and she made the point that Canada, along with a lot of other nations in the world, have made formal commitments to the Sustainable Development Goals. And equity, ending poverty, and well-being concepts are at the core of those SDGs. So could a framework for health and all policies and considering that approach, could it come from be built on the social development goals, since a lot of work has already gone into that development? And Karen, if I didn't quite get it right, maybe make a comment in the chat. But are either of you familiar with the goals?
I can discuss that a little bit, maybe, Dianne.
Sure.
When we were at the Healthy Cities Conference in Belfast, we realized that there were a number of presentations and different initiatives that were highlighted that were connecting healthy city strategies to the Sustainable Development Goals. And then there were cities, especially within Europe, that were working really hard to figure out what the links were between their work and those goals. And it was intriguing to us. It wasn't something that we had put a lot of energy or thought into in the past, but something I think that we will in the future try to better understand how our work does connect. So I can't necessarily say, oh yes, this is what we're doing and that kind of thing at this point, but I think it's something that we'll definitely look into and try to figure out how to connect those. It makes sense that trying to connect the work of health and all policies with those broader goals that are happening at that international level. I like that. There's something about that really, really appeals to me. I just can't quite figure that out yet in terms of how it might look on the ground.
Yeah, and the more we can link to those broader frameworks and concepts, the stronger it can make the work and the approach, right? I think we have time for one more question. It is 3:30, but I'm going to sneak this one in. There was a question about evaluating partnerships, and I know we've talked about evaluation a bit, but recognizing that partnerships take time and that help affect change takes time, how can we look at evaluating partnerships?
So that's sort of what we've been thinking about with our research project, Harmonix, is we are focused on evaluating essentially the implementation of health and all policies. And what I mean by that is not does health and all policies lead to greater health equity, but our research question is how and why do government sectors work together? We want to know, how do you get people around the table and working on projects? So our outcomes are sustainable, strong partnerships, or less sustainable, weaker partnerships. So our research focuses exactly on that issue, I think, in terms of evaluating partnerships, because and so we think about it in terms, just to give you a quick flavor, of acceptability and feasibility. I mean, what drives partnerships together in government to work on this is partners finding health and all policies acceptable to their particular department and mandate. And so you've got to find ways to foster that acceptability and feasibility. Sectors need to know that this new amount of work, as was alluded to earlier, is they can do it, they have the capacity to do it, and if they don't, there's resources there to help them. And that, functions largely on trying to build health and all policies into already existing governance processes and using already existing tools if you can. Try to do it without introducing too much so that it's perceived to be feasible. So maybe that person can look at some of our papers in terms of evidence about how partnerships come together or don't.
Can I just jump in quickly too on that? Is that okay? I said in my presentation that relationships are essential to this kind of stuff, and it's spending that time and energy working on those relationships and nurturing them is vital to the process. So given all that, we actually, as part of our evaluation framework that we developed for the Plan H program, have looked at the question of how do you evaluate partnerships. And I'm going to hand it over quickly, I know we only have a minute or two, to our evaluation impact specialist, Dianne Oickle, who's going to give you a little bit more information.
Sure. Hi, Dianne.
Great. Thanks, Victoria, and thank you, everyone, for that question. So that's definitely something that we looked at, as Victoria said, and where we started with that question was really based on the World Health Organization's Healthy Cities approach, and really understanding that it is very important to work towards helping support multi-sectoral partnerships and also understanding that there are benefits to that and evaluating them. Because we're working on the ground with such diverse communities, one of the challenges that we came up against was deciding on what indicators we can expect to reasonably measure, what can we expect based on the activities that we actually do with communities so that what we're measuring is actually feasible and applicable to our work. And there's lots of different tools out there for measuring partnerships. The way that we've decided to pilot this year is to really focus on the strengths of partnerships, so looking at whether our work with them has helped strengthen partnerships across sectors, and also we're very interested in understanding the strengths of partnerships and how that's changed between local governments and health authorities. So we really looked at the literature, but then looked at our own context and identified that was a relationship that was very important to us to evaluate. And what we're doing as well is we're going to be using a mixed methods approach to understand from different angles and from different perspectives how partnerships are changing and what our contribution was to those partnership changes, if any. So we're going to be using surveys, but also key informant interviews and focus groups to understand a little bit more about that situation. So it's very exploratory, but that's a general sense of our process right now. Thank you.
That sounds excellent. That sounds like really, really exciting work. Thank you for that. And with that, we are over time because there was such tremendous interest, and so I will close. I'd like to thank our speakers, Ketan, Shankardass, and Victoria Barr, as well as Dianne for her comment on evaluation there at the end. Please take a few minutes to fill out the evaluation and be very honest with your feedback, and let us know what else about this topic you'd like to know and anything we could do to improve future webinars. And